Hello everyone, welcome to the first of your hybrid lectures. Today we're going to be going over the basics of the nursing process and each of the steps. This lecture itself will focus mostly on the assessment portion of the nursing process, which is how we get that process started. The nursing process itself is a 5-step systemic method for given patient care. It involves assessing, diagnosing, planning, implementing, and evaluating. That is what makes the nursing process. There is a little acronyms that we like to name the nursing process, and we go by ADPI. So A for assessment, D for diagnoses, P for planning, I for implementing, and E for evaluating. So ADPI is the nursing process. So you might hear at some point ADPI or something like that. That is what we're talking about. So what is assessment? Well, assessment is the systemic and continuous collection, validation, and communication with patients. Assessment is a major part of the nurse's role when taking care of patients. Assessment is what gets us to get information on what is going on with the patient. Assessment is the first of 6 standards provided by the American Nurses Association for nursing practice. The collection of the data, which is known as assessment, is a vital component of the nursing process. So there are 4 types of nursing assessments. The first type is called the comprehensive nursing assessment, which results in baseline data that enables the nurse to make a judgment on patient's healthy status, the patient's ability to do things, how they manage their own health, and what are their needs for nursing care. It will help create the care plan and help to deliver patient care. An example of a comprehensive initial assessment for nurses is what happens when a nurse gets a new patient onto their unit, or if they're working in long-term care. That is when the nurse that accepts the patient has gotten report will do a complete head-to-toe assessment, comprehensive. It includes histories and can be psychosocial. It can be everything. It is very detailed. It is so that the nurse can get a baseline for the patient and to figure out what they need to focus on. The assessment for a nurse is more problem solving, or how do I put it? It is when a nurse will focus their attention on a certain thing. So an example, if the patient that you are taking care of is here because of abdominal pain, so they might focus their assessment in the abdominal area and anything that has to do with the abdomen, so that they can gather more data to see if they can figure out what's going on. Part of the focus assessment is so that they can, it's usually an ongoing assessment, so it'll be done multiple times in a day, always dependent on facility specifics, and usually helps identify new or things that have been overlooked from the comprehensive assessment. An emergency assessment is what it is. It's an emergency. It is to identify life-threatening situations and problems. So this would be something that a lot of people do in like an emergency room setting. So they have a patient that came in from a car accident or a gunshot wound. Whatever the emergency is, they want to focus on the emergent issues going on, and then later can do an overall assessment once the patient is stabilized. So the time-lapse assessment is done really to compare the status of the baseline of the patient. This is truly done in settings such as long-term care or residential settings for needing revision of their plan of care. So this is, say, you're working in a long-term care facility. This patient has been there for months. It is time to do a new assessment. Will likely be a comprehensive initial assessment or a comprehensive assessment again, and then compare it to the one when the patient was admitted or whatever the time lapse is. So nursing assessments versus medical assessments. So a nursing assessment focuses on the patient's response to the illness, as opposed to a medical assessment that will target data that will point to a pathological condition. A lot of the information that we gather from medical diagnosis, we can assess on a patient and see how the patient is responding to that illness or pathological condition. To note, some of the nursing assessments sometimes will help and aid the medical assessment and help find conditions or pathological conditions that the nurse has collected data on. So what I'm saying is a nurse can assess something, and that assessment result will give information to the doctor or provider that helps find that pathological condition. So what kind of data are we looking for in an assessment? So in an assessment, we are looking for objective data and subjective data. So objective data is observable and measurable. So it can be seen, it can be heard, felt, measured by someone other than the person experiencing themselves. If one nurse can see it and another nurse can validate it, that is objective data. Also known as the signs. That is opposed to subjective data, which is data given to you by the subject. So the subject being the patient, the person, the client that you are assessing. So the person affected can report it, and it is information given only by the person. In some circumstances, such as if you're taking care of a child or somebody that's incapable of communicating, other people can report subjective data. Take some time to write some basic objective and subjective data that you can find from a patient. So whether it is a fever or the patient reports something, write them down and classify them as subjective and objective data. This will get you to familiarize and help you with that confusion. I do remember going through this in nursing school, where I could not figure out what was objective and subjective. An easy way is objective is observable, and subjective is the subject or the person that it's happening to. So, but definitely take some time to know the differences so that you can figure out which one is which. All right, so here are some examples of objective versus subjective. So if you take an elevated temperature, that is objective because you did it and you got the information. If you take a blood pressure reading, it is a objective measurement or data because you collected it. Vomiting is something you saw. diarrhea, something you saw. The skin moisture, so either you feel the moisture in the skin or you can see that the patient is diaphoretic and sweaty. So those are all objective data because you observe it or feel it, touch it, whatever, you use your five senses, as opposed to subjective data where the patient or client will report to you, I'm feeling dizzy, I'm feeling anxious, I'm feeling nauseous, I have pain, 10 out of 10. Those are the subjective datas. All right, so what are the four phases of the nurse interview? So we have the preparatory phase, the introduction phase, the working phase, and the termination phase. So the nurse interview is basically you coming in to assess your patient, and you're prepping, and it's everything you're going to get ready and do and gather all your data. So it's kind of like what you're doing for the assessment. So the preparatory phase, as it says, preparatory, is you're preparing for this part of your interview. So that is you're gathering information, you're gathering all your materials you're going to need, you're going to organize, you're going to plan time, and then you're approaching the patient once you're ready. The introduction phase, that is you introducing yourself to the patient and probably the patient introducing themselves to you. So, hi, my name is Josefa Castro. I'm your nurse. I'm going to be doing an assessment on you. This will include me doing some stuff like listening to your heart, your lungs. I'm also probably going to ask you questions about your history, your current state, your medication history, and things like that. And then the working phase, so this is like the big part of the nurse interview. So the working phase is the one where you're gonna do the bulk of the work. So this will be you gathering all the data, so asking all the questions, making sure you have the right patient, making sure that they're giving you the right date of birth, and then you're doing your assessment and gathering all that objective and subjective data. So some of the things you'll be collecting, the data that you'll be collecting in the working phase is biographical data, reason for seeking care, history, family history. You're going to do your review of systems, so that is the actual physical assessment part, and then social history, any concerns the patient has, things like that. And then finally, the termination phase, which is kind of like one of those things we, as nurses, especially when we've worked for a long time and it's almost like transactional. The termination phase is when you complete everything, your assessment, and this is the part where you tell your patient, thank you for letting me assess you. This is the end. I'm done for right now. I'm going to go document your information, and I will be back in a bit. If ask if they have questions or if they need anything at the moment, and then you can let them know that you're going to come back at a certain time if that's what's going to happen. But this is letting the patient know that you're done doing what you were doing, as opposed to just kind of leaving the patient and walking out of the room. So we have the sources of data. So that is where you get all the data, so all the objective and subjective information that you are going to gather. So number one, the first one on top, patient. So the patient data, or anything the patient tells you, is the most reliable, the most important, and it is where you're going to get all your subjective data. Most patients are definitely willing to share this. So, especially if they have an ongoing problem or issue and there's a reason that they are there and that you are their nurse. Second is family, significant other, close friends, things like that. They can be a helpful source of data. This is especially true if the patient is a child or has or is incapable of communicating or able to provide data, or um, they aren't able to provide data for whatever reason. Maybe they are an elderly patient with Alzheimer's and things like that. The patient record, this can be done by different members of the healthcare team. So like nursing notes, other nurse care plans, progress notes from doctors, things like that. Their medical history, their medical physical exam. So that's like any information the main providers provide. So like what they see in their history or what they see in their physical examination and their progress notes and things like that, their history and physical, that information is where you can get that. Consultations, that would be data from specific areas of care. So that can be like a consultation with a renal doctor or a OBGYN doctor, depending on the type of patient you have. Reports such as labs and other diagnostics. So a big part of the nursing assessment and gathering data is looking up patient labs and their diagnostics. So knowing the normals and the abnormals and things like that. So that is a good source of data. Additionally, reports by therapy. So that would be like reports by dietitians, reports by the occupational therapist, the physical therapist, even like the clergy or the social worker, the lactation consultant, to name a few. This is where you can also get some data. I forgot to mention with the family and significant other source of data, you have to make sure that the patient is comfortable with them giving that data, or it's okay, or so that we're not breaching a lot of confidentiality. All right, so now that we've delved into a lot of the information for assessing, so preparing for data collection, so that means, preparing, gathering all your material, making sure you have the right patient, getting all the right information, collecting the data. So collecting the data, that's you doing your physical assessment or your initial assessment, focus assessment, whatever type of assessment that you're doing, that you are looking at other sources of data if needed, so lab work, doctor's notes, and things like that. Identifying the cues and making inferences. So like if you're taking care of a patient that has come in with abdominal pain and they're throwing up and they have a temperature, and you notice that they're reporting their abdominal pain in their right lower quadrant. So you're gonna start to like kind of think, oh, what's going on? What is going on with this patient? And that's called an inference. So if you can identify that maybe this patient has appendicitis, then that's an inference. Obviously, you wouldn't make that diagnosis, but that's something that you're okay. So maybe I need to report this to the physician. Maybe this is an emergency, or whatever that you're inferencing, you're going to validate it by the rest of your data. Clustering related data is so all that so let's go back to this potential appendicitis patient. So you got this patient who came in with severe abdominal pain. They're reporting it as the lower right quadrant. They have been vomiting. They they're in the emergency room, so they got some lab work done. Their lab work comes back and it looks like they have some sort of infection going on. We are able to see that with the white blood count being elevated. So that's clustering data, and you're identifying a pattern. So like, okay, this is happening, this is happening. So maybe we need to know, we need to move forward with our assessment and get to reporting this data so that this patient can get care that they need. All right, so here is a case study. So we have Jal Jones. He is a 73-year-old male. He was admitted to the unit with a diagnosis of chronic obstructive pulmonary disease, or COPD. He states that he has had difficulty breathing when walking short distances. He also reports that feeling of heart racing at the same time. He states, "I am tired all the time. While talking to you, he is fidgety and seems to stare into space a lot." His vital signs are as follow. Heart rate is at 120, blood pressure is 140/79, his respiratory rate is at 21, his oxygen saturation is at 89% on room air, and the patient's temperature is at 98.6, and patient is not reporting pain, so he denies that he has pain. So can you tell me what are some objective and subjective data that you can see in this case study? All right, so let's see what objective data we got. So I would say this one is objective, right? Because it's measurable. This is measurable. This is measurable. This one as well. And this one. And then the subjective data would be, let me just change the color here to orange. So denies pain, that's subjective. I am tired all of the time, that is subjective. Heart racing, difficulty breathing are just some subjective data that you would see in this case study. So this is just a small way of identifying those type of things. So starting now, anytime you have your labs, your simulations, you go to clinical, it's important for you guys to start, gathering that data, doing your assessment, and figuring out what is subjective, what is objective. That way you're able to move on into the next part of the nursing process. So with that being said, we have made it to the end of the PowerPoint 4 assessment, and we'll move on to the next part of the nursing care plan, which is the diagnosis part.